Okay, that's it. Okay, so once again, just to say hello to everybody, my name's Paulina Trevenna, and I'd like to take you through some research, through the latest research really into aphantasia and mental health, and tell you what we know and what we don't know yet. And it will be mainly other people's research, some of my own research as well. And I want to make this understandable, and at the same time, I want to make it practical. So as I say, if you guys have questions or want to share something, let's leave that towards the end. But, I'm more than happy to listen to what people have to say or ask. And, and my slides don't want to change. Okay. Right, so I am going to be I'm going to speak to 3 points, basically. So I am going to talk about how our visualization ability impacts on our mental health, or having or not having certain mental health conditions, or being more likely to have rather than not having certain mental health conditions. Then I'll speak about what we know about aphantasia and the links with trauma or links with mental health, well-being. And lastly, I'll kind of take you through why I am speaking about all of this really. And my main thing is to make mental health support accessible to people, whether they can visualize or not. And my own experience and other people's experiences point to the fact that it's not always accessible because aphantasia is poorly understood. And just to introduce myself very briefly, so as I said, my name is Paulina. I'm a social scientist by background, so I'm not a neuroscientist. I'm not a specialist on the brain. So just bear with me. If you ask me complex questions about brain structures, I might not be able to answer those. And I was in academic research for almost 20 years as a social scientist, and then retrained as a hypnotherapist. So now I work as a hypnotherapist, ADHD coach, and because I'm aphantasic myself, and because I came across this barrier when I was training in hypnosis, it kind of turned out that my aphantasia was a bit of a barrier to experiencing hypnosis the way most people did in my course, or experiencing it at all. And that's why I started looking into aphantasia and hypnosis. As a researcher, I just couldn't stop myself, basically. And that's why I'm here today. And that's why I'm talking about it in the hypnotherapy world and therapy world in general. I just think we really need more awareness that there are these differences in how people picture things in their mind's eye, and we need to understand them basically to best support people. And before I dive into the details of aphantasia, I would just like to scope mental imagery abilities in the room, actually. So no, I don't need to stop showing this. Sorry, I'm just trying to make this screen a bit bigger so I can see all of you without stopping sharing my screen. So I would just like all of you, just to close your eyes for a moment for me. Just do the classic, meaning imagine an apple. So imagine an apple in your mind's eye as clearly as you can, and just really focus on that apple. Focus on whatever you're imagining, however you're imagining it. Okay. And I'd like you to open your eyes and have a look at this simplified graph of mental imagery abilities. So some people can see an apple as clearly as in real life, which is illustrated by number 5. And some people can't see it at all. It's completely blank there. And that's illustrated by number 1. And I was just wondering, in terms of you guys, if you could let me know in the chat, where are you? Where are you on this graph? Are you a 1? Are you a 5? Are you somewhere in between? Okay, so there's 1, 1, 1. So a few people who have aphantasia. Okay, so there's Claire is a 5. Okay. 2, 3. Which would be more typical? Well, 3, 4 would be the most typical. And George is a 2. Laurie is a 1. Between 3 and 4. Between 1 and 2. Okay, so just to say, if you are a 5 and you see that apple in your mind's eye as realistically as in real life, you are not typical. You are hyperphantasia. So hyperphantasia is more frequent than aphantasia, but still you're not the average visualizer. You're a really, really, really good visualizer. Most people are somewhere between a 3 and a 4, or more of a 4, more of a 3. People who are a 2 are kind of borderline aphantasic and share a lot of the characteristics that aphantasic people have. So you might be able to kind of work out that there is some image in your mind, but you can't really see it too clearly. And it might be that it's like a fleeting image. You might see it sometimes, not all the time. You can't really hold it in your mind's eye too well. And so if you're a 2, you're kind of borderline aphantasic, or you might be aphantasic. And if you're a 1, if it's like completely black there, then you're definitely aphantasic, at least in the visual sense, right? And I'd just like you all to close your eyes once again for me, and I'll just run another another little test past you. So just close your eyes once again, please. And now I'd just like you to imagine that you are in an apple orchard. And it's a beautiful sunny day. It's not too cold, it's not too warm, it's just right, nice and warm and sunny. And I'd just like you to tune into everything around you. So tune into the feeling of those rays of sun on your face. And tune into any sounds. What can you hear? Can you hear the leaves rustling, or maybe birds chirping, or bird song? And maybe kick off your shoes and just take a little walk on that lovely, lovely, lovely grass. So soft. And I'd just like you to take a deep breath in and out, and really smell everything around you. You can smell the grass. You can walk up to a tree and just smell that tree. And you're looking at all these beautiful apples, and you decide that actually you quite fancy eating one. So I'd just like you to reach out and pick an apple and take a crunch and take it up to your nose and smell it and just enjoy the taste. And I'd like you to take another deep breath in and out, and just come back to the room and open your eyes. And I'd just like to ask you, and again, maybe just if you could type it in the chat. So who here was able to tap into all of the senses that I mentioned? So who here was able to experience a sense of smell, feel the rays of sun? If you were able to, type a 5. That will relate to what we did earlier. So if you were able to experience all of the senses, type a 5. Okay. So you've got a few people who can. Oh, that's interesting, Monica, because I think you were a 1 in terms of the visual sense, right? But you're a 5 in terms of all the, or did I get that wrong maybe? But you're a 5. I think I noticed that earlier.
You're correct. Yeah. Visually, I'm a 1. All the other senses, very heightened.
Okay, cool. Lucky you. Okay. And okay, so there's a few people who could tune into all of those senses. What about, are there people here who could tune into some of the senses I mentioned, but not all of them? If so, type a 3. And if you couldn't tune into any of the senses at all, not at all, type in a 1, please. Okay. Yeah, so I can see there's quite a lot of people who are like me, and we can't experience any of those senses. And then some people can experience some of them, but not all, and some people could experience all of the senses. And the reason why I do this exercise with people is because until a few years ago, basically, it was aphantasia was understood as a lack of visual imagery, and that was it. But the more research we do into it, the more it became apparent that aphantasia usually affects more than one sense. So most people with aphantasia don't have the visual, but also find it hard to tune into one or more of other internal senses. So that might be, taste, smell, touch. What else do we have? Taste, I've mentioned, hearing, auditory, and movement as well. And some people can't tune into any internal sense at all. That would be me. That was a few people here on this call, and that is now referred to as global aphantasia. So you can say that we are completely aphantasic or it's global aphantasia. And I think, for people with aphantasia, it just might be interesting that some people do have a really strong other internal sense. And for those of you who are mental health practitioners or professionals working with people, I think it's important to understand that, some people just don't have the visual, but can really tune into other internal senses. So that makes it easier maybe to work with them when you're doing some guided imagery, kind of, I want to say guided visualization, just guided, I've forgotten the word, guided processes. And other people don't have any internal sense. And those are the people that usually find it quite difficult to tune into any guided process where you're just kind of referring to the senses, basically, to the internal senses. But I'll come back to that later. But just wanted to make it clear that aphantasia is not just about the visual sense. In most cases, it affects two or more senses. And for about 25% of people with aphantasia, it affects all senses. And I'm talking about aphantasia and mental health today. And of course, we need some kind of reference. So the reference I've chosen is quite obvious, are people who can visualize. And first of all, I just wanted to show you some information about what we know about aphantasia, hyperphantasia, and visualizers versus non-visualizers. And also just to mention, sorry, I've just realized that I also wanted to mention that if you want to check if somebody has aphantasia, this so-called Apple test is probably the simplest way. If you want to check if they can tune into other senses, it's easy enough to do what I call the orchards test. So some kind of guided imagery where you're testing all other senses. There's also a more scientific, let's say, way of checking mental imagery, which is the vividness of visual imagery questionnaire, where basically people are asked to imagine something and then answer 4 questions on the basis of that. And the maximum you can score in this test is 80. The minimum is 16 because there's 16 questions. So if you answer 1, so you've got no image at all, you're just thinking of the object, you score 16, and that would be me. If you can see everything as perfectly clear and vivid as in real seeing, that would be an 80. And that would be hyperphantasia. So that just to explain that, because I'm going to mention that in a moment. In terms of visual imagery and mental health and what we know about it, I'll discuss 3 things. So how visual ability relates to propensity or a tendency for certain mental health conditions. What is the prevalence? So how frequent these conditions are among visualizers versus aphantasics, and then what do we know about aphantasia and trauma, which is something very often discussed in the hypnotherapy world or therapy world more generally, I guess. Sorry. So if you have a look at aphantasia versus hyperphantasia, the basic characteristic of aphantasia is no or weak mental imagery. As I mentioned, for most people, other internal senses will also be affected, and for some people, all internal senses are affected. For people on the other side of the imagery spectrum. For hypervisualizers, they can see stuff as in real seeing. And usually people who have hyperphantasia have it kind of across all senses. Usually they are really good in tuning into their internal senses. Now, it's said that about 4% of the population has aphantasia, understood as either not seeing anything at all in their mind's eye or having a very, very dim image. And about 11% have hyperphantasia. So a VVIQ score, that's the test I spoke about a moment ago, between 75 and 80. As you can see, there's some uncertainty around the numbers because it's such a new research area, really, that we're finding stuff out all the time. And I have to say, there is much more interest and much more research into aphantasia than hyperphantasia. Now, in terms of gender, there doesn't seem to be a gender bias for aphantasia, meaning there's not more men or women who would have it. But in terms of hyperphantasia, so the super kind of ability to see things in your mind's eye, it's more women have it than men. Something that I think is quite important for all of us to understand, and for practitioners especially, maybe, is that aphantasia obviously impacts on your memory, on autobiographical memory. So not necessarily memory for facts, but memory for things from your own life, memory of events, of what happened. But also it impacts on your future thinking, how you can imagine the future. And what has been found is that about 50% of people who have aphantasia also have what's referred to as SDAM, so that's severely deficient autobiographical memory, which I think tells us a lot about the link between mental imagery and remembering, remembering the past. And but what's also been found that it's not just about remembering past events that might be difficult for people with aphantasia. It's also imagining future scenarios. So imagining yourself in the future. And anybody who does hypnotherapy knows that we often do something that's called future pacing. So it's like imagine yourself having achieved this goal, imagine yourself in 6 months' time. And that might be something that is difficult for people with aphantasia to tune into. With people with hyperphantasia, it's again the opposite. They usually have a very good autobiographical memory and this very good ability to tune into the kind of future scenarios. And I can see this has been cut a bit, but something that often surprises people is that most people with aphantasia do have visual dreams, but usually they're apparently kind of reduced imagery across all senses or just across the visual sense, whereas people with hyperphantasia usually have more vivid dreams. And just to say that the imagery in dreams, for us, like for the average person, that's really surprising. We're like, so how can you not, create images in your mind when you're awake, but you can when you're asleep? But apparently, from a neuroscience point of view, this is not surprising because it's different areas of the brain, different regions of the brain that are responsible for imagery in sleep and imagery in wakeful state, and it's different neurochemicals at play. So apparently, it's not surprising. But I think, for the average person, we're always like, what? Why? Now, in terms of the links between aphantasia, hyperphantasia, and mental health conditions, what research has found is that mental imagery is a so-called emotional amplifier. So if you have really good mental imagery abilities, you can really tune into those internal senses, you might actually have a higher propensity for some mental health conditions, for some diseases where these mental abilities somehow not interfere, but make you more likely to have them. And those are things like hallucinations, which isn't really surprising because a lot of them are visual. But conditions such as schizophrenia or Parkinson's disease or bipolar spectrum disorders. And what we were also observing is that, and I don't think there's research into ADHD yet, but I'm definitely observing this among ADHDers, that there seems to be a higher propensity for people who are neurodivergent for both aphantasia and hyperphantasia. So it's more frequent among people who are neurodivergent to be on the imagery extremes and either have a really good visualization ability or a really poor one. And in terms of aphantasia, we've not really, so far, research hasn't really found any link with aphantasia and propensity for some kind of mental health condition, which is either good news or means that they just haven't found it yet. But what they have found was when they were doing some lab research, they were showing people troubling films, so things like car accidents, and then measuring how people who could visualize and how people who could not visualize reacted to them, and then measuring whether they had some kind of visual intrusions a few days later, a few weeks later. And it appeared that people who have aphantasia have less intrusions in general, not just visual, but in general. And that compared to people who could visualize. And that led some researchers to come to the conclusion that maybe aphantasia is a shield against trauma. And if you have aphantasia, maybe you're less prone to having trauma. However, that's not necessarily true. And I'll dive into that in a moment. Sorry, I'm having some problems with moving these slides for some reason. Maybe I should just click. Is that easier? That is easier. Okay. And recently there's been a big study comparing mental health among people with aphantasia and visualizers. It's a study by a team of researchers from Liverpool University and Edge Hill University in the UK. And what they found when they were comparing these two groups was that there doesn't seem to be a statistical difference for most mental health conditions. So for things like depression, generalized anxiety disorder, social anxiety, PTSD. And I know if you look at the percentages, there is a difference, but it's about some kind of statistical tests that I don't understand, but I've spoken to the author of this research and the papers, and basically let's not pay too much attention to that because it doesn't really matter. Statistically, there are little, well, the differences aren't statistically meaningful for those four conditions. However, when they looked at bipolar disorder or OCD, it's quite clear that people people who can visualize have a higher propensity. There's a higher prevalence of these conditions among people who can visualize than among the people who cannot visualize. So bipolar disorder, OCD. And another thing that's quite characteristic and very different for people with aphantasia is that people with aphantasia, I mentioned earlier this research, lab-based research, that showed that people with aphantasia have less intrusions after seeing something traumatic. And this is kind of borne out by this research as well. It was observed that people who can visualize get many more intrusions than emotional intrusions than people, or emotional, visual, all kinds of intrusions than people who cannot visualize. And this is most visible when you look at PTSD, where 93% of people who can visualize did report getting intrusions, as compared to 43% of people with aphantasia, which I think is really important to understand in terms of actually diagnosing PTSD among people with aphantasia. Now, in terms of the types of intrusions, they were looking at visual intrusions and what they referred to as emotional intrusions. And emotional intrusions can be things like feeling that you're re-experiencing the emotion. So suddenly you're hit by a panic attack, or you just feel like you're there in some kind of traumatic situation again, or you have, you suffer from some kind of negative emotions or feel depressed. So those would be understood as emotional intrusions. Now, if you look at the visual intrusions, quite understandably, people with aphantasia mostly didn't have them. Some people reported having them, but just to point out, as I said, aphantasia is also understood as weak mental imagery. So those people who can kind of sometimes see something, might have suffered some kind of visual intrusions. But if you look at how people who can visualize experience the same thing, many, many, many more of them did have visual intrusions. But if you look at emotional intrusions, there's not a big difference between people who have aphantasia and people who can actually, who have mental imagery. And I'm moving on to aphantasia and trauma, because that is a really big topic. As I said, I keep being asked about it in the hypnotherapy world. And I'll just straight start by saying that there's a lot we don't know yet. There's a lot we don't know. And some people have this theory that aphantasia, that trauma causes aphantasia. And just to be clear, that in some cases, yes, it does, because I forgot actually to mention that most people have aphantasia. For most people, it's an inborn condition. It's a congenital condition, and you can see a genetic link. So in many families, aphantasia runs in families, or mental imagery extremes runs in families. So it's a bit like the same as with, ADHD or autism, which also often run in families. However, some people can acquire aphantasia, and that can be because of a brain injury, or it can be because of some kind of serious psychological disorder, like schizophrenia, or something happens, and literally it looks like the mind does shut out visualization. Now, this in some, as I say, for some people in certain situations. Now, this has led to a lot of speculation, really, and people saying, oh, well, in that case, maybe it's not really a congenital condition. Maybe it's not an inborn condition. Maybe it's because of childhood trauma. Maybe it's because of trauma at an early age. I don't want to kind of say it either way, because the truth is we don't really know, right? My personal opinion is that there's a lot of evidence for, as I say, a genetic link as well, and I just find it a bit hard to imagine that everybody would have this childhood trauma. And that's why. So I don't think we should make that assumption. But at the same time, as I say, there's a lot we don't know. Maybe there's something we shall find out at some point. And as I said, in terms of research, some research has argued that it's a protective factor against trauma, but this is definitely not true. It's not true that people who have aphantasia cannot experience trauma, cannot experience PTSD. But what we do know is that people with aphantasia experience it differently than people who can visualize. So, as I've already mentioned, people will have less negative intrusions and lower levels of re-experiencing the event. But at the same time, they've got higher levels of feeling negative about themselves. They suffer more disturbances in relationships, so basically difficulties in personal relationships, and more difficulties with things like self-organization, with just with being organized, planning, that kind of thing, which actually these symptoms point to complex PTSD rather than, let's say, just PTSD. And considering this, PTSD can often get missed in people with aphantasia, because usually you have to tick the box that says that you do have visual intrusions. And if people who are diagnosing PTSD are not aware of aphantasia, that can go under the radar for quite a long time. In terms of aphantasia and mental well-being, so there's not really, whether if you have aphantasia, it doesn't mean that it impacts on your well-being negatively at all. However, some research points to the fact, and that's something I'm observing among people who are getting in touch with me. I quite often see that people are distressed by having found out they have aphantasia, and they just feel distressed about having the condition. And that's something that's been shown in research as well. So research by Monzel and the team found that 35% of the people with aphantasia that they spoke to reported distress associated with their condition, and higher levels of anxiety, depression, lower well-being. And what's interesting from a mental health point of view also is that it was more frequent among people who had these problems, big problems of autobiographical memory, that they were feeling affected. And those who have difficulty in kind of reading other people, other people's faces, other people's emotions. That's something that's called theory of mind in psychology, and it's often linked to autism spectrum disorder. So, so aphantasia doesn't need to impact people negatively, but a lot of people just feel some kind of grief and or disappointment, I guess, or they feel it's a limitation, and then it can affect you negatively, right? Because everything in life is basically a matter of perception, as many people say. Um, and moving on to aphantasia and accessing mental health support. Now, this is something that, as I said, I've experienced as well, and I'm sure many people with aphantasia have experienced. First of all, as I said, there are a lot of assessments that are based on visual ability, on checking if you have intrusions, visual intrusions, that kind of stuff, for example, PTSD. And then that is kind of biased against people who cannot visualize. Another barrier we come across in accessing mental health support is the lack of awareness or lack of understanding of aphantasia. And I don't know if you've heard my little aphantasia psychotherapy story, but that was, I still remember, and it happened over 20 years ago, that when I was seeking support and I went for psychotherapy, I came across this psychotherapist who was trying to use, I think she mentioned that she does Gestalt psychology, which didn't really mean much to me, but in one of our sessions, she invited me to sit, to come into, to go into a separate room and sit on a chair, like by the wall. And then she said to me, like, imagine, like in the middle of the room, there's this little Paulina playing, and what is she doing? What can you see? And I was thinking, what is this woman on about? Like, what is she on? Literally thought this woman was deranged, literally. And needless to say, I kind of, after that session, I left the room and I never came back to her, never, ever. And, that was over 20 years ago. Aphantasia wasn't even named at the time, but now looking back at that experience, I'm like, ooh, it was probably a complete clash of mental imagery abilities. I strongly suspect that woman was hyperphantasia, because I remember she told me I can imagine things with my eyes open or my eyes closed, and I think she was trying to get me to do some inner child work, whatever she was trying, I'm not really sure. And obviously, she wasn't aware that there are people who just can't see anything, can't imagine anything that way, whether their eyes are open or closed. And so yeah, so that was a big clash. But I'm just giving you that example to show you like how it can impact on accessing mental health support. Because if somebody, if a practitioner does that to you and you can't visualize, if you don't know it's even a thing, you'll just think they're completely mad. If you know it's a thing, then you might be able to inform them. You might be able to find a different way of working. But it takes awareness on both sides, really, or at least on one side. And then, and this use of visual techniques in various therapeutic modalities can be an issue. But especially in terms of diagnosing PTSD, I just wanted to show you that going back to the research I mentioned earlier, that they found that around 74% of aphantasics thought that their inability to visualize was a problem in being diagnosed with PTSD, or they thought it might be a problem. They weren't really sure. But if you have a look at just this column, you can see that it's frequently an issue when you can't visualize and you're seeking an assessment for certain mental health conditions, because it is very often a diagnostic criterion. So that was just my story. And moving on to my hobby horse, which is hypnosis. I just wanted to mention, and it's not going to relate just to hypnosis. That's why I think it's useful both for practitioners and people with aphantasia to know that, when we're trying to access mental health support, when we're trying to access certain types of treatment, um, often the problem is the practitioner is used to using certain techniques. Often they're using visual techniques. And often we know about it and we have certain expectations, right? Based on either our, I don't know, some friends' experiences or other people's experiences that we know about. And a lot of people, have this expectation that if they're going for a hypnosis session, that means that they have to be able to visualize. In many cases, they are not wrong because it is quite a standard process to ask people to visualize or guide them through some kind of mental imagery when you're doing hypnosis, but it doesn't have to be that way. And people with aphantasia are also quite often very analytical thinkers and often very literal thinkers, which I think often comes with the autism spectrum disorder. So if you're telling people who cannot see things to see things, they will often treat it quite literally and just get either annoyed or discouraged or disappointed, but not be able to kind of find a different way. I found that some people who have aphantasia but a strong other internal sense, even if somebody is asking them to see things, they'll kind of automatically translate that into hearing things or touching things if that sense is strong. But many people will just be completely thrown off track if you ask them to visualize, see, picture, and so on. And some of us are a bit over controlling, maybe. So we find it a bit difficult to just let go and go with the process. That's frequently linked with being quite analytical. So in terms of barriers to accessing things like hypnosis, but also psychotherapy and other time meditation, other types of things, as I mentioned, a lot of people are really thrown off track by words such as see, picture, visualize, and some people don't really even like the word imagine because they think of imagine tied to an image, so they interpret it as seeing. And in terms of hypnotherapy, it's also other techniques. So guided visualization is often very difficult, especially if it's fast-paced, if you've got constantly changing imagery. That is really, really, really difficult and often completely ineffective for people who have aphantasia. Then regression, I mentioned in the beginning that, so taking people back to a certain point in time or a certain emotion. As I mentioned in the beginning, people with aphantasia often have a difficulty with tuning into past I said past memories, but it also relates to past emotional states. So that might not be the best way of working with us, basically. I also mentioned that we have a problem with imagining ourselves in the future and often also with dissociation techniques. So things like imagine drifting out of your body. Because people with aphantasia often have a problem of imagining movement, that kind of thing is not for everyone, but for many of us, kind of just beyond our imagination abilities, and we can't really tune into those kind of processes. So just to wrap up, I'm glad to say I'm wrapping up. So visual imagery, we know from research that visual imagery abilities are linked to certain mental health conditions, and it actually seems that having aphantasia might be an advantage in this case because or at least we know more about the links between being a really good visualizer and certain mental health conditions than we know about being a non-visualizer and certain mental health conditions. Oh, what's happened here? Sorry. And as I said, the links between aphantasia and trauma are so far poorly understood, but we can be absolutely sure that aphantasia is not a shield against trauma, and that people with aphantasia just experience trauma differently and certain mental health conditions differently than people who can visualize. So in terms of implications for practice, for the practitioners, and the aphantasics, because I think it's often down to us to actually educate people that we come into contact with, and especially mental health practitioners, because there's not much understanding or knowledge of aphantasia yet. And we just need more understanding so that people realize that they need to approach us differently, that they need to work with us differently than with visualizers, that it's not about the technique, it's more about working with the person. And And I think practitioners just need to be able to recognize aphantasia. And the easiest thing is just like the what I showed you in the beginning, the apple test, the so-called orchard test. Just run very simple tests and then evaluate like, might this be impacting on your client's mental health in particular ways? As I said, some people feel like grief or really disappointment or sadness around the condition. Might there be any comorbid conditions? So might there be any other conditions that come along with aphantasia? As I mentioned, people with aphantasia have a higher propensity for being on the autism spectrum, for having autism or ADHD. Might you need to adjust assessment criteria if you're a practitioner? For example, for things like PTSD or things where usually you'd look at imagery and intrusions, for example. And might you need to adjust your therapy techniques. Okay, and so that's all the information that I have for you today, and then we can jump into a Q&A. If any of you are not members of the Facebook group but would like to be, then please feel free to join, and you can just scan that QR code. If you're a hypnotherapist and you'd like to have a look at a cheat sheet that I have for you with the description, like the basics of what aphantasia is and just the tests and some general guidelines about working with non-visualizers, then please scan that, and I'll pop the links in the chat in a moment. And just to mention that I do have a training coming up for hypnotherapists in particular next Monday. I'll pop the link in the chat in a moment if anybody is interested. And at the moment, I'm running a discount code on the tickets. And if you thought this talk was useful, if you found it useful, I would love it if you could leave me a review, because I'm building up this stuff. I really want to educate everybody about it, and it just helps with visibility if you yeah, it just helps with visibility if you have reviews. Okay, so I shall just make this, I'll leave this on the screen for a moment. I'll just make this bigger. Sorry, I'm